though probably a lot more.
Calls for more testing capacity from Washington State, now making plans to reopen its economy. This week, modeling out of the University of Washington indicates transmission rates are down and projects the state could safely reopen as early as May 18th.
My view is that we should transition from a large social distancing strategy to a strategy of testing and robust contact tracing. When we get the number down low enough.
Aaron, Washington State is looking at antibody testing. What about other states?
That's right, Jose. The University of Washington's expected to begin its antibody testing early next week, joining testing efforts in Colorado, California, and Florida, really seen as critical to understanding the spread of this disease. Jose?
Aaron McLaughlin in Los Angeles, thank you. The economic ripple effects of coronavirus have been hitting millions of Americans, now struggling to simply put food on the family table. Morgan Chesky tonight with the challenges of feeding America.
Tonight, it's the growing fate facing millions of Americans. Lines stretching from coast to coast, from families trying to find their next meal.
Thank you. Have a good day.
In Fort Worth, Texas, Elizabeth Lewis Hernandez went through this line for the very first time. The fresh food a blessing for her family after being laid off as a waitress.
If you didn't have a place like this, what would you do?
I mean, I would know, really, to be honest. I mean, I've never been in this type of situation like this. I've always, worked. I've always been able to support myself, support my family. It's always been okay. It's a lot different right now.
Those helping are feeling the difference, too. At Tarrant Area Food Bank, staff boxes up about 1 million meals a week. The big question, how to keep up with demand.
Supply is not endless. We have no idea, when the supply will run out. And so we're 4 weeks into this, and we're 60% above our normal distribution amounts. It is 4 weeks. It's just 4 weeks.
The National Grocers Association admitting the strain, writing, given the unprecedented demand in many markets and the disruption COVID-19 has caused, the supply chain is still working to catch up. The Trump administration announcing a $19 billion bailout package for farmers hurt in the crisis. The majority of that going to those still tasked with feeding Americans. For small businesses, the fight isn't over food, but funding. With nearly $350 billion in federal loans already handed out, many owners no longer wondering if they'll close, but when.
I'm scared for a lot of small businesses, especially, I'm scared for everyone. I'm playing the game like I'm not getting a loan, even though I'm supposed to.
An estimated 171 million Americans are planning on a government stimulus check. This week, nearly half of those checks have gone out.
Morgan, we're hearing about unprecedented demand. What are food banks doing to keep up?
Yeah, Jose, the game plan is definitely shifting. Here at Tarrant Area Food Bank, they didn't want to replicate those long lines we've seen all over the country. So what they've done is deploy mobile pantries throughout the community. And so far, they're feeding about 250,000 people every week. Jose?
Morgan Chesky in Fort Worth, Texas. Thank you very much. Coming up next, we've told you how plasma from coronavirus survivors is helping fight the disease in others, how researchers are now developing an even stronger plasma. And throughout the program, we're going to showcase the moments that unite us, like this celebration from a Florida kennel, now empty for the very first time after all the dogs were adopted. We're back now with the search for solutions. As researchers scramble to find ways to fight the coronavirus, we have an exclusive look at how 6 competing drug companies are working together to put a new twist on an old treatment. Ann Thompson reports.
In Ridgewood, New Jersey, doctors at Valley Hospital are taking plasma from recovered COVID-19 patients and directly infusing it in 16 people fighting the virus.
How sick are the patients that you have infused with this convalescent plasma?
They're ill. They're either on the verge of requiring mechanical ventilation, or they already are.
Similar plasma trials are taking place at hospitals across the country. The transfer of virus-fighting antibodies via plasma worked in past epidemics, including the 1918 flu and the SARS outbreak. But there is no control over the quantity or quality of the antibodies from any one person's plasma.
Every unit is different.
because every unit is coming from a donor that has a different immune system and experience.
Now, 6 competing drug companies are taking the rare step of working together, creating a more potent, concentrated plasma with the hope of saving lives.
We collect plasma from a lot of people. We concentrate it down. We find the antibodies, and we can make sure we have the quality right and the consistency of the product.
And so is a realistic timeline early next year?
We hope to be able to beat that timeline. By working together and pooling our resources, we can accelerate the development.
Donating their plasma at one of 500 sites nationwide, Melanie and John Herring. They contracted COVID-19 in January on the Diamond Princess cruise ship. She was asymptomatic, he was hospitalized.
What's it like to hear, we don't know how to treat it?
It's frightening. It's frightening to not know how long you're going to be in a hospital.
Words they want no one to hear again. Now in the testing phase, doctors caution that no plasma treatment is a magic bullet.
Defeating this virus is going to require layered defenses. We're going to need antibodies, we're going to need drugs, and we're going to need vaccines.
Searching for optimism in a time of despair. Ann Thompson, NBC News, New York.
And still ahead, one country's risky experiment. They're not shutting down even as people die. But is it working? And there's this moment of unity. Police in Fort Myers, Florida, in a different kind of formation, creating a heart for healthcare workers. In the fight against coronavirus, there is one country betting that not locking down could, in the long term, be a better decision. Here's Bill Neely with the report.
Crisis? What crisis? In Sweden, things look almost normal. Crowded cafes, restaurants full, playgrounds and streets too. Sweden's government didn't order a lockdown, preferring a light touch of advising people to socially distance.
I think it's good, and it's been good. I feel safe.
Sweden is gambling on allowing a slow spread of the virus and more early deaths to avoid future deadly spikes.
Other countries are locking down, but in that case, they will probably see a second wave and a third wave.
If we did follow that approach, I think we might have 2 million people dead.
President Trump says Sweden's goal is herd immunity, and it's suffering. Sweden denies that and says it's being sensible.
It is a myth that life goes on as normal in Sweden.
But infections in Sweden are rising, and its death rate is now far higher than its neighbours. 150 deaths for every million people, compared to 60 deaths a million in Denmark, 30 in Norway, 16 in Finland. Many are horrified at Sweden's gamble.
I'm a scientist. I don't trust authorities. I trust data.
For Americans living in Sweden, these are nervous times.
I think I'd rather be in Stockholm than New York City.
It makes me feel kind of scared sometimes because I know that my parents are super worried.
Sweden's Prime Minister says thousands will die, so it's building field hospitals. Sweden and all of us are living in a huge high-risk experiment. We won't know for months, maybe years, which approach was right. Lockdown or liberty? For now, Sweden, unique in Europe, is confident its death rate is peaking. Millions are trusting its gamble pays off. Bill Neely, NBC News, London.
There's this special moment from Ecuador. A firefighter playing his trumpet from high above, lifting spirits of those